Social distancing, it's a new term for a lot of people. It was a fairly new term for myself prior to all this happening. And so really the biggest reason that it's important is because a lot of the people that are going to be contagious and come down with the coronavirus are going to be asymptomatic, and they're not even going to know that they're out there spreading it. And so we don't have enough testing capability to be able to test everybody, so we can't know who those people are. And so the social distancing measures that they're putting in place are to help prevent those people from getting out there and spreading it to people that are at higher risk. If you can limit the contact of a contagious person to 75% less than what it normally would be, in 5 days they'll only infect like 0.6 people versus 2.5 people if they just had normal contact. But at 30 days, the difference is huge. It's if you don't limit social contact and don't do any social distancing, then it's over 400 people that one person will infect, but only 2.5 people that they'll infect if they're decreasing their social contact by 75%. The higher risk people that are going to get complications from this are people that have a suppressed immune system. And so, people that are elderly, over the age of 60, especially if they have any comorbidities like COPD, diabetes, heart disease, if they're undergoing cancer treatment, things like that, they're going to be those are going to be the ones at risk from dying from this. Basically, the way that it works is that if we can slow the spread of the disease, most people are probably going to end up seeing this virus. Their body's going to interact with it in some way. The vast majority of people probably are over the next year. But if we can slow the time span in which that people were exposed, then hospitals will be able to handle those people that are at risk, that get complications. They'll be able to have more ventilators available to treat them. And basically, you've seen articles, coming out now with, flattening the curve. Instead of having a big spike of cases in a month, if we can flatten those cases out over 6 months or a year, then the chances of those higher risk people getting exposed is lower in a short period of time, and then hospitals are more likely to handle them when they get sick. Mainly a big spike in deaths. Especially if a lot of healthcare workers get exposed quickly, and if they get sick and they have to go on quarantine, just not having the resources. With what we're seeing in Italy, their doctors are having to decide who gets to have care and who dies, basically, and we're wanting to avoid having to make those decisions, those tough decisions. So for younger, healthier people, most of us are going to have a mild illness, probably maybe flu-like illness at the most, and it'll be uncomfortable for a week or two. But it's not going to cause any long-term effects for that population. But really, the main thing to drive home with the young, healthy population is that if they come in contact with people and they get sick or they're contagious, then they're going to be that person that spreads it to somebody else and be more likely to infect somebody's grandma or grandpa or their own. So that's the biggest reason. So right now, with the measures they're recommending, it's really tough. They're wanting people to work from home if possible, which obviously isn't something that can happen in that type of industry. And so, if you have people that have gone to job sites in areas that are at higher risk for contracting the coronavirus, if those people can stay in the same work group, go to the same job sites, limit them interacting with other people who haven't been to those higher risk areas, and then doing some good screening on them, asking when they come in if they have any symptoms. You can check for a temperature. Use a thermometer, check for a temp when they come in, an infrared thermometer. You don't have to touch them. which is helpful. It doesn't catch those asymptomatic people, which is what we're worried about. So hopefully soon they're working on more rapid testing to be more widely available. And if we can do that and we can test more people like South Korea has been doing, then we may be able to help that a little bit more, so where we can identify those asymptomatic people sooner. If somebody has been in those areas, have them wear a surgical mask, and then just emphasizing outside of work and going home, really trying not to do anything else. If you can do online grocery pickup or delivery, those types of things, and really just keep their contact between work and home, that's going to be the best. So they do have symptoms, and typically the symptoms they'll be similar to the flu. Usually it's going to be fever, dry cough, maybe shortness of breath, fatigue. Usually you're not going to see things like sore throat, runny nose. It's probably a different virus if that's the case. There are some reports of those symptoms, but those are a lot less likely. So if you have the fever, dry cough, shortness of breath, fatigue, get tested for flu. First, rule that out. If it's flu, it's unlikely that it's coronavirus as well, although there are starting to be some reports that there can be co-infection with both. Getting that flu test first is going to be a lot easier than what the COVID-19 test is currently, and a lot less expensive. This time of year, it's really tough to differentiate sometimes between seasonal allergies and viral symptoms. Some big key differentiators. Usually, you're going to have itchy, watery eyes with allergies that you won't see with the virus. Sneezing, runny nose, which can happen with the virus, but thankfully we're not seeing as much with the coronavirus. Some people may have a little bit of a cough with allergies, which is tricky given the coronavirus, but typically with the coronavirus they'll have fever and fatigue, body aches, and so looking for those itchy eyes, sneezing, those types of things should be able to help clear that up pretty easily. And then if you have good primary care that you can contact and help differentiate that. And then also, if they're not on treatment, starting treatment for allergy symptoms and seeing if it gets better. Maintaining 6 feet, not being in close contact with somebody, and briefly walking by somebody is not a big deal with close contact. It's usually indoor contact, close contact for at least 10 minutes. And so if you're in Walmart or in the office and just walking by somebody, it's probably not going to be a big issue. But then not touching your face when you're sneezing or coughing, into your elbow, not into your hands. And then using hand sanitizer, washing your hands properly. If you don't have hand sanitizer, so properly is at least 20 seconds, soapy water. Sing happy birthday a couple times. Yeah. I mean, if it's not able to be, if the allergy symptoms can't be controlled with medication, which hopefully they could, but if they can't, then yeah, especially during this period of time we're in, wearing a mask would be a good idea. Mm-hmm. Yeah, so if you have any employees that have been working out of state and they're in areas that are seeing a lot more cases of coronavirus, when they come back, keeping the people that were, if there's multiple people that were on that job, if they can all continue to work in the same area, and whether the same in the building or on local job sites, try to keep them from interacting with other people that were not in those areas, and that way if they are asymptomatic but contagious, it's not going to be spread to other people that weren't already exposed. Treatment-wise, they've started doing some studies with actually an old malaria drug, chloroquine, and they combine it with zinc, and it's actually shown a lot of promise with inhibiting the virus from replicating inside our bodies. And so, and what's great about that is it's not an expensive drug. You know, it's not a new brand name drug that people have to pay thousands of dollars for to do the treatment. It's pretty cheap, and it looks like it works pretty well. And there's even some studies adding an antibiotic with that, which typically, you know, as a physician, it almost like makes my hair stand on end to recommend an antibiotic for for a virus. But some of the early, they're small studies, but show pretty big promise with that. So hopeful that even if, you know, maybe we are behind the 8 ball and the cat's already out of the bag and it's going to spread whether we do anything or not, it's at least reassuring that there's some treatment options, and for people that do get sick, hopefully we can prevent a lot of deaths. With China, you know, where it started, they're already closing down some of their temporary hospitals they put up, so the cases are trailing off. So that's light at the end of the tunnel that, you know, some people talking about that we're going to be dealing with this for a year, you know, but from what China's doing, it doesn't seem like it's going to last that long, which is good. And then some other countries that seem to have instituted strict social distancing quickly, like Singapore, have pretty flat curve as far as the number of new cases. And so that's reassuring as well that, you know, hopefully we're not doing this in vain, and, you know, the economy's worsening and all that, that it's actually going to be effective. I own a clinic called Command Family Medicine, and it's a direct primary care clinic, so different than traditional insurance-based practice. Our patients pay us a monthly membership to be part of the clinic, and, you know, with that, if they need visits, we have longer appointment times. You're not waiting for a couple hours when you come in. But also a big benefit is telemedicine's built right into it, and you get your doctor's number. You can text, call, email pretty much any time. You're going to be talking to somebody that knows you. There's a lot of telemedicine options out there, which are great and very helpful. But you're not always going to get somebody who knows who you are, and so we can really help navigate, you know, the craziness of the healthcare system in general, and with what's going on right now. You know, when it may be difficult to get in and talk to somebody. And there's a telemedicine company that I actually do some work on the side for, and, you know, right now, like I logged in earlier, there was 200 people waiting to take a call, and prior to all this coronavirus, the most I'd see is maybe 10, and so they're getting overloaded. And so, but here we limit the number of patients that each physician or provider takes, and so we minimize that from happening to where we have time to be able to get back to people quickly and help them out. For us, our patients, they can just text us and say, hey, you know, either I got exposed to somebody who had a fever, I was sitting in the same cubicle with them all day, I got that question yesterday, you know, do I need to be worried, do I need to go quarantine myself? And so, or emails, the same thing. I had a lady that, you know, was coughing and developed a fever today, and so we're, you know, working through that and helping find the right testing options, and so we can be that, you know, we can help out and keep people from, you know, having to go to the urgent care or ER unnecessarily and say, oh no, just stay home, just keep social distancing yourself, or no, you need to be tested, and we can help get through those proper channels. You know, right now in Springfield, the health department is only doing testing for Cox, Mercy, and Jordan Valley, and so, but Cox is doing free telemedicine visits and helping people get connected to get tested if they need to. And so our patients that I think may need to be tested, that's the route we're going right now until hopefully there's more testing kits available for us to be able to do it ourselves. Things you can be taking to help be able to fight this off if you were to come in contact with it. Zinc has some good evidence. You know, if you take, right now, just take like a daily zinc supplement, so that, you know, could be Zicam or over-the-counter capsule. but the zinc can help inhibit the virus from replicating. And so that's a good thing. Just take daily right now. Take it with food. It will upset your stomach a little bit. And then, you combine that with vitamin C. Echinacea is a good one as well. Vitamin D is pretty key in the immune system, and thankfully days are getting a little bit longer. We're still not seeing a lot of sunshine yet, and so taking a vitamin D supplement as well. And then, one of the more underutilized immune system boosts is just getting a good night's sleep. So if you can get 7 to 9 hours of sleep at night, your body's going to be set up to fight viruses a lot better.